This is Urban Health Today, and I'm speaking with Angela Talton, System Senior Vice President and Chief Diversity, Equity, and Inclusion Officer for City of Hope. She's here to talk about the recent partnership between City of Hope and Charles R. Drew University of Medicine and Science and their collaboration to increase diversity in the medical field. Thank you for speaking with me today, Angela.
Mara, thank you so much for this opportunity.
It's so great to have you. All right, let's get started. Please talk about your background and your work with City of Hope.
Well, I'm the System Senior Vice President and Chief Diversity, Equity, and Inclusion Officer, which means I'm responsible for the development and implementation of a holistic and integrated vision and strategy for advancing diversity, equity, and inclusion, improving health equity, and ensuring measurable accountability and commitment throughout our entire organization of 13,000 employees and staff. Also, as a not-for-profit hospital, I'm responsible for our community benefit program. Now, I've been in DEI for over 10 years. Most recently, I served as the Chief Diversity Officer for Nielsen, the market research company.
Oh, wow.
But a little bit of my background that's a little different, Tamara, is that I did not follow the HR track to diversity, equity, and inclusion. My background is actually in operations, leading very large 2,000 plus employee call centers. And coming from operations, my daily focus is on creating measurable, impactful outcomes. And always, always, always connecting the dots between diversity, equity, and inclusion and the overarching strategy of the organization. I think it is key for DEI to always be in line and be seen as a pathway to accomplishing the goals of an organization.
When you say holistic, what does that mean in this case? What does that look like?
Well, thank you. It's a focus on a little bit of everything from leadership development, recruitment, retention, our communication strategy around DEI, of course, a focus on health equity and, as I said, community benefit, but also our philanthropic giving, our supplier diversity, ensuring that we are working with local, minority-owned, women-owned, LGBT-owned organizations, as well as tracking and trending our analytics.
What are the goals of the partnership between City of Hope and Charles R. Drew University? And how will it help diversify the medical field?
Absolutely. Thank you for that question. So the goal of this partnership is to educate a more diverse workforce in specialized medicine and to address the health disparities within the medical field. And we want to do this by offering internships, curriculum, training, practical mentorships, and joint research projects. You know, it's our desire to promote and facilitate opportunities whereby these medical students are able to gain information and insight regarding the specialized medical practice and biomedical research in oncology and diabetes service lines. You know, the enrollment in medical schools increased significantly in 2020. And, you know, just with the civil unrest and with the murder of George Floyd, it was to the tune of about 40% or so increase with Black and Brown students. And what we're seeking to do is to take the opportunity to ensure these students see specialization as an option for them. And it can take many forms. We envision opportunities such as in-person visits, virtual experiences, summer internships, and then practical mentoring with our City of Hope fellows and residents, as well as joint research projects that can be conducted by principal investigators at City of Hope and PIs at Charles Drew as well. So the ultimate goal is, of course, is this shared commitment to close the health equity gap for people of color and to ensure that that medical field has more diversity.
So how does this collaboration enhance clinical and research capabilities for your respective institutions?
So we at City of Hope were attracted to Charles Drew University because of its proximity to City of Hope and our desire, again, for some of that in-person engagement, seeing that it is a HBCU and a MSI, minority serving institution. Their representation percentages are extremely high with Black African American students as well as Hispanic Latinx students. And so we saw this opportunity to increase the diversity in our service lines around oncology and diabetes. But the partnership will also allow us to enhance the education and training of those students. We want to offer clinical and research summer internships, didactic curriculum that includes insights into cancer incident rates across different demographic communities, health equity, of course, DEI, and then other trending topics in healthcare. The students will also, as I mentioned, have access to mentoring and coaching, and we want to do this with our faculty in the graduate medical education realm. So with recent fellows, with current residents, and we also would like to participate on staff at Charles Drew with a 4-week class on oncology and hematology. It's part of their new MD program.
Oh, this sounds exciting. So how will the specialized education, training, and mentorship opportunities provided through this collaboration address critical health disparities in underserved communities?
So we want to enhance the education and training of these students. And again, sharing insights, what we have discovered through our research on cancer incident rates. This will be a key component of the program. Focusing on things like early detection, focusing on clinical trial enrollment, because although we're doing the research, it takes that clinical trial participation in order to validate the findings from the research. And we know how important it is to have diversity within those clinical trials because we're seeking a cure, right? We're seeking a cure for these life-threatening diseases, and not for a small subset of the population, but for all patients who have been touched by cancer and diabetes. Also, tomorrow, in the US, we're really concerned that there's this gap between the current era of cancer innovation and the people who need and actually have access to these breakthroughs. And so at City of Hope, we recognize that our industry needs to close that gap by advancing equity to all patients. And we actually lead a coalition. It's called The Cancer Care is Different. And there's this group that advocates for systemic change to increase underserved populations' access to specialized cancer care. I'll tell you, this coalition championed changes in the law, in the California Cancer Care Equity Act. That's the name of the law that was passed in 2022. And the goal is to ensure that all Californians, including people on Medi-Cal, have the right to request treatment at an NCI designated cancer care center where they can enroll in clinical trials and receive some of these leading edge treatments. So our focus is on expanding access to optimal care for people everywhere. That is really how we are working to address some of the critical health disparities in underserved communities.
Well, how do you increase patient awareness of this? I mean, NCI designation choice sounds wonderful, but how do you reach the larger communities to let them know that A, this is available, and B, you can use this?
Thank you. So we have several different groups and departments focused on this. We have our community outreach organization who's really helping sharing information in diverse communities. We have our physician liaison team where we're engaging our physicians to actually go out, share this information, talk about screening opportunities, provide screenings. We recently have put in play a mobile screening unit in certain of our diverse communities. And this is providing access and, again, opportunities for screening, which, as you know, early detection is key. And then, of course, our community benefit work to engage with other not-for-profits to identify from a community health needs assessment where those needs are within our catchment area and partnering with other not-for-profits to provide information, education, more awareness. And, at the end of the day, Tamara, it's also about building trust in community, right? Particularly when you talk about clinical trial enrollment. And by showcasing and sharing back with these communities our knowledge, our research, our findings, and then having people on the ground showing that dedication and commitment, this is how we're working to make a change around taking care of these underserved communities.
Let's talk about the 4-week class on oncology for medical students. How did you settle on 4 weeks given cancer's significant impact on communities of color?
Well, this is part of the Charles Drew University curriculum. So the programming around the 4 weeks has come from Charles Drew, and we're still working on the details, but I will tell you some of our focus in order to make sure that this is comprehensive is to make it inclusive of hematology, of medical oncology, radiation oncology, breast surgery, gynecological oncology, as well as hospice and palliative medicine. So we are leveraging our expertise, but basically the format of the 4 weeks that came from Charles Drew.
Okay. What outcomes do you anticipate from the joint research projects between City of Hope and CDU? How do you see them contributing to advancements in medical research?
Thank you. So this is particularly, again, looking into some of our specialty. We're looking to focus in areas of cancer, diabetes, metabolic disorders, HIV, autoimmune disease, nursing, as well as precision medicine. So these projects are expected to contribute to that innovative treatment approaches and improving the healthcare outcomes. So a combination of leveraging our knowledge, our research, but also focusing in on some of those innovative treatments. That's where we plan to focus.
So City of Hope was recently recognized by FAIR 360 as one of the nation's top hospitals and health systems for diversity, equity, and inclusion. Can you highlight some of the DEI initiatives that City of Hope contributed to this recognition?
Absolutely. And we participate in the FAIR 360 survey because it's a comprehensive review of the work that's being done around DEI. They basically focus on 6 key areas of workplace fairness, and those are human capital metrics, leadership accountability, talent programs, workforce practices, supplier fairness, as well as philanthropic giving. And so this ranking we attribute to our commitment and, again, that holistic approach across the entire hospital, the entire system. So clinical, research, as well as administrative. And we have a DEI mission at City of Hope, and that's to infuse DEI into our DNA at City of Hope. So an example of one of our key initiatives has been this system-wide DEI training program. We call it a situational inclusivity learning journey. And it is complete with interactive modules of relevant scenarios that reflect our daily experiences. And that's experiences with patients, it's experiences in our laboratories, it's staff members and how we interact with each other. And there's basically a series of both instructor-led and online classes that lay the groundwork for an inclusive culture that's based on changing your own actions and behaviors to become more consciously inclusive. And so City of Hope, we've partnered with a minority business enterprise, an MBE, the Kaleidoscope Group, to co-create this training. This is not off-the-shelf training. This is something that we have co-created and tailored to City of Hope. Additionally, our focus on social determinants of health, on supportive care initiatives aimed toward increasing access to optimal health education and care were also instrumental in our ranking.
Did Fair 360 include any feedback from employees and or patients?
So in the survey, we were able to share our that we have an engagement survey and some of the highlights from that, but it does not ask for specifics around that. But Tamara, if I can share, we at City of Hope, we participate in the Press Ganey engagement survey. Is something that quite a few hospitals are engaged with. There is a DEI component, a 5-question composite score that includes a focus on the organization, but also the relationship with your manager and the relationship with your coworker. And over the past 3 years, we've seen improvement in that DEI composite score across all aspects of City of Hope. So clinical, research, administrative, we've seen improvement in our DEI composite scores, and particularly the scores around my relationship with my manager and my relationship with my coworkers. We attribute to the training that our employees have received because that is the focus. The focus is on creating a more consciously inclusive City of Hope.
Congratulations, by the way. Recognition for health systems these days is sort of hard to come by. So congratulations on that.
Thank you so much.
Mhm. What impact do you hope this partnership will have on overall efforts to bring diversity, equity, and inclusion to medical research and healthcare delivery? Are there any future collaborations with other minority serving institutions?
Well, I'll tell you, Tamara, this is a long-term goal for us, right? We're not in this just for a quick fix. This is a partnership that is really important to us. And so by having this strategic alliance, we hope to foster more innovative research. We recognize having diverse voices, having diverse ideas, skills, experiences at the table, the result of that is going to be more innovation. And so we're really looking for that aspect. For the educational opportunities, expanding access to these students to the work that we're doing at City of Hope, as well as addressing health disparities and promoting diversity in specialized medical fields. My partners in this work are Dr. Chandana Banerjee. She's our Dean and Designated Institutional Officer and Director of the Graduate Medical Education Administration. And she is so excited about the opportunity for our fellows and our residents to engage and mentor and coach these sort of next generation of oncologists and researchers. Very, very excited about the work that we can do there and just leverage some of her current programs. My other partner in this is Dr. John Carpton. He's our Chief Scientific Officer, Director of the Cancer Center and also director of our Beckman Research Institute. So really seeing more diversity within the laboratories around research for cancer and other life-threatening diseases. We're so excited about this. So this partnership, we envision it as a model. We're beginning with Charles Drew to create that blueprint, but we want this to be a model that we can work with other HBCUs and minority serving institutions, and with our national footprint. We are actually in talk with some HBCUs on the East Coast about future partnerships. So I'm
Oh,
super excited about this work.
absolutely wonderful. Wow. I will say that I was very fortunate to have a woman of color. I talk about this to death, but yeah, I had prophylactic mastectomy last year because I had the BRCA2 gene mutation. I lost my mother to metastatic breast cancer. And I was having like a little bit of a tug of war with my providers. And it's not until I met and connected with my my Black woman physician that things changed and my outlook became much wider and brighter, and it made such a huge difference, I think, in my outcome. So there is absolutely, I'm here to say there's absolute value in having physicians and having specialists that look like you and can understand where you're coming from. It makes such a world of difference to, some providers will say, well, what difference does it make? It's the training. No, it's looking across at somebody who is going to understand exactly where you're coming from. And that makes all the difference in the disparity space. And I think that would close the disparity gap.
Appreciate
Yeah.
you sharing that because it is really important to patients. I think there's some study out there where patients, like 40% of the time when they have members of that clinical team that represent their cultural background, they're more apt to follow the treatment regimen. They're more apt to really engage with that clinical team, and that's going to result in better outcomes. So I really appreciate you sharing that. And it is something that I tell our I speak at orientation as often as I can, and I tell that story and I share that stat because I want people to understand that having diversity in the medical field is key, and engaging and understand the cultural nuances of diverse communities is really important in that engagement, that one-on-one engagement with the patient, with their families and their caregivers as well.
Just having that was just so meaningful to me. It just completely changed the game for me. I went from no, I don't trust you and I won't be doing this to absolutely, you're right. This makes sense. I'm laughing, but it's the truth. It really does. And I'm living proof of it. So I can tell you that it is extremely important, and anyone who tries to downplay that has no idea what they're talking about.
Well, thank you, Tamara. Can I just add one last line?
Sure.
Because you sort of opened the door a little bit
Oh.
with that. Anyone who says that DEI is not important. And so I just want to say at City of Hope, diversity, equity, and inclusion is about scientific discovery. It's about expanding access to optimal outcomes, and it's about finding a cure for all. This is about science and DNA. And guess what? Different communities, different cultures have different DNA. It's important. It's about expanding access. Everyone today does not have access to the
Right.
same innovative breakthroughs. We're seeking to change that. And it's about a cure for everyone, for all, not just for a small subset of the population. And so you cannot separate DEI from the work that we do.
That's absolutely right. Absolutely right. How do you explain that, by the way, how do you explain that to your non-color counterparts?
So One of the first things I did when I joined City of Hope, after listening sessions and talking to people in clinical and research and administration at all different levels, was to come back, and I literally created a slide that walks through what I just said. It walks through our focus on genomic research and how, at the end of the day, our goal is to match the treatment to the individual DNA of that patient. It's about science. It talks about the fact that, you can really say that diversity equals innovation, right? It's being inclusive of different skills and experiences and knowledge and cultural backgrounds. There's a connection. And then, oh, by the way, with clinical trials, you have to build trust in community. You have to have members of your team who understand these different diverse communities, because we can't validate research without clinical trials. And so I walk our organization through and connect the dots of DEI to our overarching mission to make hope a reality for all touched by cancer and diabetes. And by doing that, it takes away the naysayers. And Tamara, I think in today's world, that's what we have to do. We have to take back the narrative around what DEI is and how it is an important, integral imperative to every organization.
I had a talk with somebody several weeks ago, and he basically helps with recruitment for institutions, diverse, because they have been unsuccessful, let's say, for example. So he's the person they call when they're unable to get diverse participants in their clinical trials. And one of the things he revealed to me, which was really interesting, was that it actually costs more per marginalized or a diverse person to recruit them than a mainstream person. I thought that was fascinating. And so what happened is they do a cost benefit analysis and they say, nah, this is just too expensive. We've got to move on.
So I know at City of Hope, and I don't have the cost information, but I know at City of Hope, our percent representation for our clinical trials is at parity or better than the representation within our catchment areas. We focus on that. We make sure that that is a key component of building our clinical trials, because again, we understand that diversity matters in order for us to ensure that the innovation, the new research, the new findings are going to be applicable and at what level for different groups. So that is a key component of the work that we're doing around clinical trials.
That's fantastic. Is there anything else you would like other people to know about the work you guys are doing?
Thank you so much. I just wanted to put that last piece in there about how important DEI is for us. And I guess I'll just say again, our mission is not a tagline. Our DEI mission is to infuse DEI into our DNA at City of Hope. And we make it a point to connect the dots of DEI to our overarching strategy. And that's how we keep it relevant. And that's how I'm able to share this messaging throughout the organization, throughout the system. And it's being received at City of Hope.
Angela Talton, thank you so much for your work in being a part of the solution. I really appreciate you.
Thank you so much. I appreciate this time.